Imagine your uterus is like a house, and its inner lining is like the carpet inside. Now, picture bits of that carpet showing up outside the house. That's a bit like what happens with endometriosis. Endometriosis happens when the tissue similar to the lining of the uterus grows outside of it. It's a common condition among women where about 10 to 15 out of every 100 women with gynecological issue have it. Doctors often find it during surgeries done to explore pain or fertility problems. But interestingly, it can also be found in women without any noticeable symptoms like during sterilization procedures. When doctors want to check for endometriosis, they use a tiny camera during a procedure called laparoscopy. They look for small or big abnormal spots like wounds in the pelvic area. These spots can mess up the normal setup of your pelvis. The, the extra tissue doesn't follow the usual rules and can bleed, causing inflammation. As it heals, it can create adhesions like sticky connections between organs. Sometimes this leads to the formation of cysts called chocolate cysts. The appearance of these things varies depending on when someone checks for them or when doctors check for them. Doctors don't really know why some women get this disease. It tends to stick around and spread because of hormones from the ovaries, especially in women of reproductive age. Even if someone has their ovaries removed but gets hormone treatment, it can still hang around. Some think the disease is becoming more common, possibly due to uh, things like environmental pollution, but others say it might just be that we are getting better at finding it through tests. Interestingly, how bad it looks inside during tests doesn't seem to be connected to age or symptoms in the patients. People with endometriosis can have different symptoms and they can vary a lot. If there is pain after periods, ongoing pelvic or pain during intercourse, it might be a sign of endometriosis. Also, if there is unusual bleeding from the rectum, bladder, or belly button during periods, that's strong clue. Having really heavy periods might be a cause, not just a result of endometriosis, because being exposed to period blood is a major factor in getting this condition. To figure out if someone has endometriosis, doctors check for signs during a vaginal exam. They look for things like thickening or nodules in certain ligaments, pain in specific areas, or masses in the ovaries. However, just pelvic tenderness doesn't give a clear answer, as it could be other conditions. To be sure, doctors might need to do more tests. There's a blood test called CA125, which can be higher in some cases of endometriosis, but it's not a surefire way to diagnose it. Ultrasound helps check for ovarian cysts that might be linked to endometriosis. And magnetic resonance imaging, that is MRI, is useful in specific cases, especially when there is a need for detailed planning of surgery. However, the most reliable method is laparoscopy, a procedure where doctors directly look inside the pelvis to see if there are any signs of endometriosis. Treating endometriosis can be challenging, not just physically, but also because it can often bring emotional issues. For some patients, the term endometriosis itself can be a problem as it tends to come back during their reproductive years. While there is no one-size-fits-all treatment or cure, it's important to tailor the approach based on factors like age, symptoms, the extent of the disease, and the desire for future childbearing. Doctors use different methods, including medications and surgeries. Pain relievers like NSAIDs can help with symptoms, but They don't treat the disease itself, but birth control pills can reduce pain and blood flow during periods. Hormonal treatments can also be used, but they may have side effects. One effective treatment is gonadotropin releasing hormone agonists. This induces a state similar to menopause, releasing symptoms, but they come with side effects like hot flashes. Surgical options such as laparoscopic surgery can remove visible endometriotic lesions, and in severe cases, definitive surgery like uh, hysterectomy may be considered. Unfortunately, there is no permanent cure for endometriosis. New treatments and surgeries can delay the need for more drastic measures, but for many, the disease tends to come back, making it a recurring challenge throughout their reproductive life. Thank you for joining me to explore the complexities of endometriosis. If you found this information valuable, don't forget to like, share, and subscribe for more insightful content. So stay informed, stay empowered, until next time, and take care.